Welcome, everybody. My name is Dr. Archana Shrestha, and I am one of the co-founders of the Women in White Coats blog. I'm so excited to be talking today with one of our top 12 Women in White Coat heroes, Dr. Danielle Hairston. Congratulations, Dr. Hairston, on your nomination as one of our top 12 Women in White Coat heroes.
Oh, thank you, and thank you for having me today.
Yeah, I'm so excited to talk to you and share with everyone more about all of the great work that you've been up to. I'm going to go ahead and read your bio just so everyone knows about what you've been doing.
Okay.
Dr. Danielle Hairston was raised in the Washington, D.C. metropolitan area. She attended Rutgers University for her undergraduate education and earned a degree in biological sciences. She earned her medical degree at Howard University College of Medicine, where she also went on to complete her psychiatry residency program. In 2018, Dr. Hairston returned to Howard University College of Medicine as faculty and was recently appointed as the Psychiatry Residency Program Director. Dr. Hairston has served as the Black Psychiatrists of America Scientific Program Chair since 2016. She was recently elected as the American Psychiatry Association Black Caucus President. Dr. Hairston has also had the opportunity to speak nationally and internationally about the impact of racial trauma and culture on mental health. She is a contributing author to the recently published book, Racism and Psychiatry: Contemporary Issues and Interventions. Her interests include consultation liaison psychiatry, resident education, minority mental health, cultural psychiatry, and HIV psychiatry, and collaborative care. So you have a very impressive bio and you're up to so many great things, Dr. Hairston, but let's take it back you're welcome. Let's take it back to the beginning. And how did you even decide that you wanted to become a doctor and get into the medical field?
So I don't know, just growing up as a kid, I always wanted to become a doctor, and one of my pediatricians was a female physician, and I realized like, oh, okay, this is something we can do. And I used to go to the hospital at Walter Reed because my father was in the military, and that's where we would go get military care, health care. And I realized I didn't ever think that it was possible that someone would not have a Black female doctor. I saw female doctors there, and I always thought, okay, this is something that I can do, and I want to do it. I like science. It was very odd for my family because they're all teachers. So my mother's a teacher, my sister's a teacher, my aunts are teachers. They're all in education, and they were like, are you sure you want to do this? I was like, yeah, definitely. This is what I want to do. And so they were completely supportive. And I think that growing up and having female physicians, I don't know if my mother did that deliberately, but I realized that this is an option for me. And I think that it wasn't until later in life, like college, when I realized, oh, there aren't that many of us. There actually aren't that many female physicians. Oh, there actually aren't that many Black physicians. And then there aren't that many Black female physicians. So this is definitely something I want to do to shake up what people think of when they look at a doctor.
Mm-hmm. Wow. So yeah, definitely having those role models early on helps out a lot too. And it's interesting because I maybe am biased, but I also take my kids to a female pediatrician. It might be something that could influence my kids one day, especially my daughter. Not that she could choose to do whatever she wants to do, but it's interesting that we need to see those role models in life, right? Who are like us, and that allows us to believe that it's possible. So that's a wonderful story. And so then how did you end up deciding on psychiatry? What led you to choose that field?
So coming to psychiatry was a little bit more convoluted than my decision that I wanted to go into medicine. Initially, when I started medical school, I was thinking I want to go into internal medicine because I wanted to work with HIV patients. So to me, it was like the way to work with HIV patients is to do internal medicine, to do infectious disease fellowship, and then I would eventually work in an HIV clinic. Like that's what I have been thinking. Because of some exposure that I had in undergrad, I worked in a HIV clinic, in an HIV program. So I thought, okay, that's what I want to do. That, that's the exposure I have. But then once I got to my clinical years, I was like, oh, actually, I I don't think I like internal medicine. I really like psychiatry. Like, it seems like there's something that we're missing when we do rounds and we see these patients. There's more than just what their medical issue is bothering them. And it's something that obviously and understandably it's not really addressed when you're on internal medicine rounds. Like, you don't really have time when you're a hospitalist or when you're an attending to tackle all of these questions. But I would always be the one like, oh, okay, tell me more. Or what else is going on? And like, this patient looks sad, or this patient is confused, like something's not right here. So that's when I really was like, okay, I might like psychiatry. But there's stigma, of course, in medicine about psychiatry. There's stigma in the Black community about mental health and psychiatry. So it was a difficult choice for me. But once I had the opportunity to do addiction and a consult rotation in medical school, it was definitely what I wanted to do. There was no question. So I actually changed in my 4th year what I wanted to do of medical school. So that was a little bit non-traditional, because I was all internal medicine, like internal medicine groups. And then I was like, oh, for my ERAS, by the way, everybody, I'm doing psych. And they were like, what? But it's still the best decision that I've ever made for myself. And I think for the people that I care for.
That's wonderful. Listening to your intuition really helped you out, and look at all that you've achieved now, you know, focusing still on HIV patients and their care, but also from a different perspective, not necessarily from the internal medicine perspective, but from the psychiatric perspective. And that makes such a huge difference, I'm sure. So, you know, you touched on something that kind of piqued my curiosity, just the stigma against mental health, or seeking or maybe diagnosis of mental health issues amongst the Black community. Maybe you could talk about that a little more. I know that that is one of your interests.
Yeah, sure. So I think that in the Black community, if someone has a mental health issue, or if there is even an inkling that they might have a mental health issue or a substance use issue, it's very hush hush. Like, our communities do not speak out about it as much as other communities. And I don't mean just Black communities. I mean Latinx communities, Asian communities, African communities, West Indian communities. There's much less openness than you see in some Caucasian communities in discussing if someone is depressed, if someone is anxious, if someone has an alcohol use disorder. It's not something we talk about. We're more like, well, you keep that in the back room, or you don't put your business out there in the streets, or you go see a faith healer or a leader instead of talking about it with a physician, or definitely not with a psychiatrist. So it's something that we really have to address, because we see that the numbers of patients who we actually finally do see in treatment are in crisis. They're in a worse state than if they had gotten care or had access to care earlier. So I really dedicated my career to one, speaking out about mental health and mental health issues in my community, and working with faith-based leaders so that they can really reach the people who come and talk to them and they don't know the answers to tell them. They don't know how to diagnose someone with bipolar disorder. They don't know what to say if someone has schizophrenia. Praying about it, I can say that that's helpful, but I don't know any prayer that's going to do the same job as Haldol. So, and also, it was very important for me to become a program director and to be involved in academic medicine, because I can't take this on myself, but I really wanted to work on training and educating medical students and residents who understand the impact of stigma in their communities, understand how hard it is for someone to actually be even in your emergency room, or even be in your office or on your inpatient unit, all the steps that it took, and really to understand that when you just see this snapshot of a patient in the emergency room, I'm a consult doctor, so that's where I frequently am, and you don't understand like the impact of racism, the impact of food insecurity, the impact of policies, like how much it really takes someone to come and see you when they have to decide if they're going to get medication or feed their kids. So it's a lot, and I really wanted to work on training physicians who understand that their patients are going through a lot. It's structural, it's policy, it's food, it's everything, and how this affects their mental health and then also their physical health. We can't look at them as separate. And that's exactly the kind of doctor I am, being a consult psychiatrist. I work in the hospital. I don't have a traditional like outpatient. My outpatient is working in the HIV clinic. So I see my patients there, really reaching patients where they are, because we have to understand as physicians, like there are so many things weighing on us and also weighing on our patients that we treat, and try to figure out how to mitigate those risks.
Mm-hmm. Yeah. And tell us a little bit more about the work that you do in the HIV clinic.
Sure. So as I said, like I've always been driven to this population. I have family members who have been diagnosed with HIV, and I've seen the stigma of both HIV, substance use, and mental health issues lead to them not getting the treatment that they need. And as you and many people know, if you're not treated for HIV, then you can progress into AIDS. You can progress into having HIV or AIDS dementia, and all things that now we have so many treatment options that we could work on it and stop. But when you have HIV, you're at higher risk for mental health and substance use disorders. When you have mental health and substance use disorders, you're at higher risk for contracting HIV through risky or impulsive decisions and behavior. So when there's so much connectedness, we have to work on it together. So when I'm in the clinic, I work with their primary care doctors, with their ID docs. We all work together so that they can come see all of their whole team in one location. They can come make their appointments all in one day when I'm there, when their ID doc is there, when their caseworker is there, so we can really make access to care easier for them.
Wow, that's very meaningful work. And I love how you're really looking at the full picture and looking at things holistically.
I try.
Yeah, and also like the interdisciplinary teams make such a huge difference, I'm sure, for the patient. Now I know another big interest of yours and big role that you play is as residency director and academics. And I'd love to hear how you decided to pursue academics and the things that you enjoy about working with students and residents.
I can't pinpoint one thing that led me to academics, but I guess it was always, like I said, I have the background with my mother being a teacher, my sister being a teacher, so I come from an educator background. And so I've always, I was chief resident, the educational chief resident, helping with didactic design and things like that. So I've always been interested in teaching, because I feel like if I don't know something, then I can really research it, and I know I've mastered it if I can teach it to someone else. And I really realized that there's no way that I can take care of all the people who are Black or all minorities who need help in mental health, but I can help to build a force or my little soldiers who can go out there and really say that they were trained well at Howard or wherever my previous institutions, to understand how diversity impacts, how you might miss a diagnosis if you don't pay attention to certain cultural or ethnic background aspects. So I think that I love working with the students and the residents, because they keep me on my toes. Like, you definitely, sometimes they ask you questions that you're like, where did that come from? Like, I don't know. But I like working as a team, and we can go look it up or try different things. My residents are always like, well, can we try this? Or I read about this. Well, Journal Club, we learned about this. Remember you talked about this? Now can we use it here in the clinic? I'm like, okay, sure. So I think it always keeps me like, there's never a dull day in academics, especially on the consult service, with what we face, with the different cases we treat, and really just the treatment options that the residents and students and the questions that they have. It always gives me, like, even if I'm having a bad day, like, they bring the energy, and they really help keep you on your toes and know about and keep your medical education and knowledge on point.
That's wonderful. It sounds like you're doing such a great job, and I want to congratulate you again on being one of our top 12 Women in White Coat Heroes.
Thank you.
And you are doing such great and meaningful work. And thank you so much for all you do. For those who are listening to this or watching this, we'd love for you to head on over to womeninwhitecoats.com/heroes to read more about the bios of all the top 12 women in white coat heroes, and also vote for the person that you think should be the hero of the year. And we'd love to have you all join us at the hero ceremony, where we will be honoring Dr. Hairston as well as the other top 12 women doctors. And we'd love to have you there. It's going to be in Atlanta on May 1st, and you'll get to meet these amazing women. And we'd also love to have you at our conference, Women in White Coats Conference, which is going to be taking place April 30th through May 2nd. So you can head on over to womeninwhitecoats.com/events for more details about that. And don't forget to vote. Thanks again, Danielle Hairston, for joining in. It was wonderful talking with you, and I hope you have a great rest of your day.
No problem. You too. Thank you.